Certainly we see that living with a chronic disease can lead to depression, but also I feel that depression very often leads to diabetes. Many of my patients are overeating for emotional reasons, whether it's depression or anxiety, and I do think it's the role of an endocrinologist to talk to your patients with type 2 diabetes and find out, what kind of stressors, what situational issues are occurring that are potentially leading to emotional overeating. And very often I'll end up prescribing medications for my patients with type 2 diabetes to help with the anxiety, help with the depression, or if they're amenable to it, I'll refer them over to psychiatry or psychology or therapists. 10 years ago when I was first starting out, I had a patient who was morbidly obese. He was a member of the Teamsters and he was sort of a tough guy. Didn't really want to open up to me, didn't want to take the medications, really wasn't listening to anything that I was saying. And one day I sat down with him and I said, let's talk about your childhood. Let's talk about when the obesity began. When did you start eating? Was there anything that triggered it? And this man who had been pretty difficult with me, really did not want to, it seemed like he didn't want to be my patient, started crying. And he told me that he had been abused as a child. And that was when it all began. And he never told anybody. I was the first person he told. And he was sobbing, and we spent the whole conversation not talking about the diabetes, just talking about that experience. And after that, he listened to everything I said, and he was able to lose weight. We still would talk about it each visit, but he really opened up and started to take the treatments that I recommended. And I've tried to practice that way ever since.